for medical reasons, then radiosurgery is an option. So we saw one of these patients, an 80-year-old doctor, came in after we treated a left-sided lung cancer. She got a PET scan with us this week, and she came in to show it to me, and the PET scan was completely normal.
Wow. Great results, huh?
Right. So about 6-8 months after treatment, she was really happy, feeling good, and for good reason. So we'll continue to follow her, but it's nice to see that the treatment that you give works, and we try to follow every patient that we treat. So she was one very nice example. We also had another gentleman with lung cancer that was metastatic, which means that it had traveled from the lung to another site. And in him, the other sites were in the lung. So he had 3 sites in the lung.
Mm-hmm.
He came to us about 2.5 months ago with hemoptysis, which means the cancer was eating through the blood vessels and causing him to bleed.
Oh.
Every time he coughed, he'd cough up red blood.
Yeah.
So it was really worrisome.
Wow.
He wasn't a surgical candidate either. The bleeding was getting worse and worse. He was really frightened. I was frightened too, because seeing someone die of hemoptysis when patients drowned in their own blood is terrible.
Oh, man.
So we treated him with radiosurgery, and he had the 5 treatments. I treated first the big mass in the left lung that was up against the blood vessels and the airway.
Mm-hmm.
And after the first treatment, the bleeding got better.
Oh, wow.
By the 4th treatment, there was no more blood. He came for a follow-up this week. He's had no bleeding whatsoever.
Wow.
He's really happy. And to see this man with a smile on his face is a beautiful thing.
Yeah, sure.
We treated the 3 spots.
That's great news.
He's going to go for testing, and hopefully his cancer will be in remission like that woman's
That's
cancer.
fantastic. I have a question for you, Doc.
Mm-hmm.
If these 2 patients you mentioned would have been candidates for surgery, would that have necessarily been a better option than radiosurgery?
Well, for the man, he had been evaluated by a thoracic surgeon, and they felt he was inoperable. So the cancer was up against the main critical structures in his chest, and because it was so big and its location, he was not a surgical candidate. So probably he could have gone for standard radiation, but standard radiation is weeks and weeks of treatment, usually 20, 30 treatments. More of the healthy lung and tissues are irradiated, we think, unnecessarily. We think there's a big convenience for 5 treatments. We think there's a more biologic effectiveness by giving fewer treatments, but they're more focused to the cancer. And we've been at this for years. We were the first ones to do body radiosurgery. For the woman, she probably could have had surgery, but she refused surgery.
Okay.
She's 80. She's blind. She's a physician. So she knows medicine, and she just did not want to have surgery.
Yeah.
So she had the option, and I sent her to a surgeon, but she declined surgery. She wanted the 5 treatments, and she's right now doing fantastic.
Oh, that's great. That's great.
There's also news this week that shows that men who have no sperm face a higher cancer risk. So it's an interesting study. So these are infertile men. They're men that cannot impregnate their loved ones. And the greatest risk was men with no sperm, diagnosed prior to age 30. And it may be that the infertility is a barometer, as it's quoted by Dr. Michael Eisenberg, a professor of urology at Stanford, that infertility is a barometer of health in general. And they examined 2,200 men who were infertile in Texas, seen in a special laboratory between 1989 and 2009, and 450 of them had no sperm.
So that quote by Dr. Eisenberg, that suggests that it's not the infertility that's causing the rate of cancer, but that it's an indicator of something else in the body? Okay.
So sometimes if you're frail or if you have another condition, maybe even cancer, that will reflect on the amount of sperm. So he's actually evaluating that. And actually, In the study, 29 of the men had developed cancer compared to 16 men that would be expected based upon the age of the men. Oh. So it was 1.7 times more likely. So about 70% more men had cancer if there was infertility related to no sperm.
Wow.
And he said that the lack of sperm increases the risk for developing cancer to that of a man 10 years older. So it's almost like a 30-year-old be like a 40-year-old as far as cancer risks. So it's interesting data and something that someone should think about if one is going through or your friend is going through fertility workup, just to be aware that there are other implications.
Huh.
We're going to go to a word from our sponsor, and we'll be right back. For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you. Body radiosurgery cancer treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe. Acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
News Talk Radio 710 WOR.
For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Radiosurgery New York, super conveniently located in Manhattan at 38th and Broadway. We hit the prostate cancer. Call 212-CHOICES, 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, Dayush. How are you?
Hey, Dr. Lederman.
So we are back. We are live. You can call in your questions, 1-800-321-0710.
I'm sorry, did you say 1-800-321-0710?
Yes, 1-800-321-0710. Did I say the wrong number?
No, that's right.
That's the right number. So you can use that number if you have a question. You talked about coffee before, so what's good about coffee besides the taste?
The caffeine helps wake you up when you need to get up early in the morning.
So I see you're having some coffee right now.
That's right.
There's a new study out that looks at coffee consumption reducing the risk of liver cancer. Did you know about that?
No, that's great news.
Yeah, it's good to have some good news because we don't like all bad news. And regular coffee drinkers have half the chance of getting liver cancer compared to those who never or rarely consume coffee.
Wow.
So researchers looked at a meta-analysis. A meta-analysis is a combination of multiple studies, and they put all the data together. And it was done including work in Asia and in Europe, 11 studies in Asia and 5 in Europe between 2000 and 2011. If you had high levels of coffee consumption, you had a 50% reduction in liver cancer.
Wow.
So it's good news.
What is a high level of coffee consumption defined as?
Well, the researchers in this article actually didn't define it, but it's probably 5 cups a day, something like that.
Oh wow, I got to drink more coffee.
Well, maybe. Liver cancer is a rare cancer. It's not one of the big killers, but if you have it, it's serious. And there are risk factors with liver cancer. One is cirrhosis and hepatitis C.
Okay.
And in fact, there's another article that looks at hepatitis C and liver cancer. And people with hepatitis C have increased risks. And there's treatments for hepatitis C to get rid of the virus from the liver. And there's a new study out from Sweden that showed that you can still get the cancer even 8 years after getting rid of your hepatitis C evidence in your body. So it is a serious condition. Obviously, people are better off not to get it than to get it.
So even once you've gotten rid of hepatitis C
With antiviral treatment, that's right.
with antiviral treatment, you can still get the liver cancer
Up to 8 years later, yeah.
Wow.
And this work came from the Karolinska Hospital in Stockholm. Karolinska is where the Nobel Prize is awarded for medicine. So it's a very illustrious hospital. It's actually the hospital where radiosurgery was first developed. And I went to Karolinska several times and worked with their staff and brought their staff to our facility so we could exchange thoughts and technical information and medical information.
Wow.
So it's a beautiful center. They evaluated 351 people with hepatitis C-related cirrhosis, and 110 of them had complete clearing of the virus. And then they were followed for 5 years, and 6 of the patients who had hepatitis C developed hepatocellular cancer, and some of them even 7 years after clearing. So it's a sign that even if you have a history of hepatitis C, it's not active, that you probably should have screening to
For
check
liver
your liver,
cancer.
make
Yeah.
sure your liver is okay and nothing serious is going on.
Maybe you could do those low-dose CT scans you mentioned last week.
Well, you can do ultrasound with no radiation.
Oh, even better.
Or you can do an MRI with no radiation. So you should always be thinking about what kind of imaging you get. There's a study also out this week that shows that if you can reduce the number of CAT scans in children, you can reduce the incidence of cancer from that radiation. So there isn't a risk with radiation,
Right.
and we try to limit that risk always. And people should be aware that just getting a CAT scan is not innocuous. It can cause significant symptoms, especially for children and a growing body. So
Yeah.
the incidence of doing CAT scans now is growing tremendously. A lot
It's
of
a
parents,
big business.
big business. A lot of parents bring their children in. They feel like they get that CAT scan. Maybe it's doing the best thing for the child. Maybe it's doing the right thing. But maybe not getting the CAT scan is even more right.
Yeah.
So maybe seeing the doctor and ask, can we do something other than a CAT scan? Maybe we can wait. Maybe we can get an MRI. Maybe we can get an ultrasound. Do something without radiation so you can reduce the risk of cancer in young children.
Yeah, that's always good. The thing is, everybody wants the best quality imaging, and I think that the word around the street is that that's the CAT scan, not the MRI, right?
Well, it depends for what part of the body. For the brain, MRI is certainly better. For the spine, MRI is better. It depends on each part of the body. Each part of the
Okay.
body is different.
Good
really
to know that.
It's something to think about, speak to your doctor about,
Yeah.
and try to avoid unnecessary radiation. Radiation, if you don't need it, is a great thing to stay away from.
Yeah.
We have some other patients that I wanted to speak about this week that we saw. We have another woman who's about 70, whose son is a physician. She had breast cancer in about 5 spots. And she's a little bit fragile and came in for radiosurgery, and we treated her cancer about 6 months ago. And she got a follow-up PET scan this week. And that also was totally negative, totally
Wow.
normal.
Look at that.
So the family is really ecstatic. I'm ecstatic. I'm sure the patient is ecstatic. And it's nice to know that what you do does the right thing.
It works.
I mean,